Hello everyone, I am Pavani, optometrist. Hope you all are doing good. So today I am talking about the anatomy of eyelids. Next, coming to the layer of the eyelids. So when we talk about the layer of the eyelids, it will be from the outer skin part to the inner. When we invert the eyelid, whatever the red part we are seeing, till there will be total 7 layers. So the very first part is skin. So whatever the skin we have in the eyelids is the thinnest all over the body. Compared to the skin which is present all over the body, this is the thinnest skin. Okay, and it contains the hair follicles, sweat glands as well as the sebaceous glands. What are sweat glands? These are the glands which produces the sweat from the tiny openings of our skin. Okay, so these sweat glands are not only present in the eye, these are also present throughout the body. From where it produces the sweat, there will be a tiny openings on our skin. From there, the sweat gets produced. Coming to the sweat glands which are present on the eye is nothing but the gland of mole. This gland of mole main function is it keeps the eye moist and protects the eye from the germs. So when we talk about the sweat, it is nothing but the 99% of the water. Normally the sweat doesn't smell, but it smells when it mixes with the bacteria. So coming to the sebaceous glands. Sebaceous glands are nothing but the oil glands, tiny oil glands. This helps to keeps the hair as well as the skin soft and healthy. So even these sebaceous glands not only present on the eye, it present all over the body. The main function of these oil glands is to maintain the moisture of the hair as well as the skin. Okay, so coming to the eye, there are two types of the sebaceous glands. One is meibomian gland and the other is gland of Zeiss. These meibomian glands are present inside the eyelids and this makes the oil and mixes with the tears. Why does it mixes with the tears? What is the use? Because if the water gets exposed to the air, what happens? It evaporates, right? So in order to decrease the evaporation, this oil gets mixes with the tears. As a result, the evaporation decreases and it also important for the eye moisture and comfort. So coming to the next sebaceous gland which is present in the eyelid is nothing but the gland of Zeiss. These glands are present at the base of the eyelashes. Okay, and its main function is also it makes the oil to keep the eyelashes soft and healthy. So next, coming to the second layer, it is nothing but the subcutaneous areolar tissue. This layer contains the loose connective tissue in it and it has no fat in this layer. So what do you mean by the connective tissue? The main function of the connective tissue is it works as the support of any two layers. Because this layer is present just immediately beneath the skin, it acts as the support for the skin as well as the underlying areas. Next, coming to the layer of striated muscle. Whenever you look at the striated muscle in the microscope, it contains lines on it. That is the reason why you call it as the striated muscle. It contains the lines as stripes on it. That's why there is a name called striated muscle. So the layer of striated muscle, this is the voluntary muscle. Coming to the eye, you have orbicularis oculi muscle in it. This orbicularis oculi muscle is mainly responsible for the closing of the eyelid. So this muscle is present as the oval sheet covering both the upper lid as well as the lower eyelid. And this main functioning is it is responsible for the closing of the eyelid. And it contains two parts in it. One is the palpebral part and another is the orbital part. This palpebral part is helpful for the blinking of the eyes. Okay, this orbital part is helpful for the forceful closure of the eyes. If at all if you want to close your eyes tightly, then this muscle will act, the orbital part of the muscle will act. If at all if you blink, then this palpebral part will act. So these two parts will come under the orbicularis oculi muscle. The main function of the orbicularis oculi muscle is it is responsible for the closing of the eyelid. The closing of the eyelid can be either it can be tightly or it can be as blinking. So if at all if you want to close the eye tightly, then orbital part will act. At all if you want to blink, then palpebral part will takes place. and this orbicularis oculi muscle is supplied by the zygomatic branch of the facial nerve, which is the cranial nerve 7. Apart from that, you also have the levator palpebral superioris muscle, which we also call it as the LPS muscle. The main function of this muscle is to elevate, open the eyelid, and this muscle is supplied by the oculomotor nerve, and it is present only in the upper eyelid. So if at all if there is a abnormality in the oculomotor nerve, what happens? There will be the drooping of the lid. So the drooping of the lid occurs when there is a dysfunction of the oculomotor nerve, as well as when there is the dysfunction of the LPS muscle. In both cases, you will see the drooping of the muscle. That means the upper eyelid will not elevate properly. When there is a dysfunction of the orbicularis oculi muscle, what happens? There will be the incomplete closure of the eyelid. What happens when there is an incomplete closure of the eyelid? When the eye doesn't close properly, what happens? The cornea get exposed to the air. As a result, the corneal health will get disturbed and it leads to dry eye. So next comes the fourth layer called submuscular areolar tissue. So this is the fourth layer. This layer consists of the layer of loose connective tissues, blood vessels, nerves. So as it contains the blood vessels and nerves, for any kind of eyelid surgeries, the anesthesia is mostly given to this layer, to the fourth layer. Okay, because it contains nerves in it, anesthesia is given to this layer. So next comes the layer called fibrous layer. The main function of the fibrous layer is it gives the shape, support and strength to the eyelids. How does it give shape and support? Because it contains the plate called tarsal plate, which we also called as the tarsus. It is nothing but the thick and dense connective tissue which acts as the skeleton to the eyelid. As a result, it gives the firmness and shape to the eyelid. And where does it located? It is located in both the upper lid as well as in the lower lid. In upper lid, it is more curved and larger, and in the lower lid, it is thinner and smaller. This upper tarsal and lower tarsal meet at medial and lateral canthus. And additional to this, it also contains the glands called meibomian gland. As I said in the first layer, these meibomian glands are nothing but the sebaceous glands which produces the oil. So these meibomian glands, I said that it is present inside the eyelid. So these meibomian glands are present in the fifth layer on the tarsal plate, which is arranged in the parallel rows. Additional to the tarsal plate, this fifth layer also contains septum orbital. Septum orbital, it is nothing but the thin membrane of the connective tissue. This tarsal plate is the thick membrane of the connective tissue, and this septum orbital is the thin layer of the connective tissue. In this layer, this is the point where the nerves, blood vessels and the levator palpebral superioris muscles, all these muscles enter into the eyelid from the orbit through this layer, through septum orbital. Okay, so nerves, muscles and blood vessels will get perforated in this muscle, in septum orbital, from orbit to eyelid. Where is it perforated? In the fifth layer called fibrous layer. In fibrous layer, in septum orbital, all these nerves will enter into the eyelid. Okay, so next comes the layer called layer of non-striated muscle. So this non-striated muscle is nothing but the smooth muscle, and it is involuntary. Involuntary means which is not in our control. When you look back at the striated muscle, I said it is voluntary. Voluntary means we can control it. Say for example, if at all if you want to close your eyes, that is under your control, right? You can close it. If you want to open, you can open it, which is under your control. So that you call it as the voluntary. Whereas this layer contains the smooth muscle, which is involuntary. We cannot control it. This is not in our control. And the muscle which is present in the sixth layer, the layer of non-striated muscle, is nothing but we call it as the Mueller's muscle, which lies deep into the septum orbital. Where did you read about the septum orbital? It is present in the fifth layer. So in the upper eyelid, it arises from the fibers of the levator palpebral muscle, and in the lower eyelid it arises from the prolongation of the inferior rectus muscle, and it gets inserted into the tarsal plate, peripheral margins of the tarsal plate. And coming to the function of this layer is, the main function of the Mueller's muscle is it works together with the levator palpebral muscle. What is the function of the levator palpebral muscle? It mainly useful for the elevation or raising of the upper eyelid, right? So it works along with the LPS muscle for lid elevation, as well as it also maintains the eyelid position. Sometimes this Mueller muscle may react more whenever you get surprised or stressed. What happens? You make your eyes bigger, right? That happens automatically because it is under the control of the sympathetic nervous system. This Mueller muscle will react more. So whenever you get surprised, automatically your eyes will become larger. Any damage to the sympathetic nervous system, any damage to the sympathetic nervous system causes Horner syndrome. What happens in case of Horner syndrome? There will be a drooping of eyelid. Why there will be a drooping of eyelid? Because the sympathetic nervous system will give nerve supply to the Mueller muscle. This Mueller's muscle will work along with the levator palpebral muscle. Because the levator palpebral muscle function is to elevate the eyelid, so any dysfunction of the sympathetic nervous system leads to the drooping of the eyelids, which we also call as the ptosis. Say for example, along with the sympathetic nervous system, if there is a weakness of the LPS and the Mueller's muscle, along with this, what happens in those cases? You will see severe ptosis. And coming to the seventh layer, it is nothing but the conjunctiva. Whatever the red part you see at the back of the eyelid, it is nothing but the conjunctiva. It is the mucous membrane. We call that part as the back of the eye part. We call that as the palpebral conjunctiva. So when you talk about the anatomy, unless until you complete blood supply and nerve supply, it is incomplete. See, whatever may be the part, always you should complete it with the blood supply as well as the nerve supply. And coming to the blood supply of the eyelid, it receives blood from the branches of the external and internal carotid arteries. So coming to the inner and upper eyelid, it receives the blood from the ophthalmic artery, which is the branch of the internal carotid artery. And the outer and lower eyelid receives the blood from the external carotid artery. Outer means outer part, and the lower eyelid receives the blood from the external carotid artery, and inner part and upper eyelid receives the blood from the ophthalmic artery, which is the branch of the internal carotid artery. And coming to the nerve supply, it receives the nerve supply from oculomotor nerve, which is the cranial nerve 3, which helps in elevation of the eyelid, which supplies to LPS, and the facial nerve, zygomatic branch of the facial nerve, which helps in the closure of the eyelid because it gives its nerve supply to the orbicularis oculi muscle, and also the sympathetic nervous system, which gives its nerve supply to the Mueller muscle. So coming to the summary, the first layer is nothing but the skin, where you will see the glands, sebaceous glands and the sweat glands on it. And coming to the sebaceous gland, you have two types of sebaceous glands. One is the meibomian gland, and other one is the gland of Sayce. And coming to the sweat gland, glands of mole. And coming to the second layer, it is the subcutaneous areolar tissue. In this layer is nothing but the connective tissue which gives the support to the layers. It contains no fat in it. And coming to the third layer, it is the layer of striated muscles. This is voluntary and it contains two types of muscles in it. One is the levator palpebral muscle and other is the orbicularis oculi muscle in it. Levator palpebral muscle is used for the elevation and orbicularis oculi muscle used for the closure of the eyelid. And coming to the fourth layer, it is the submuscular areolar tissue. This layer contains the blood vessels and nerves in it. So whenever the person is undergoing any eyelid surgery, the anesthesia is given to this layer. And the next layer is the fibrous layer. This layer mainly contains tarsal plate, and septum orbital on it. The main function of this fibrous layer is it gives the support, strength and shape to the eyelid because it contains the tarsal plate on it. Apart from this, it also contains the meibomian glands on the tarsal plate, which is arranged in the parallel rows, and additionally it contains the septum orbital, in which the nerves and blood vessels from the orbit enters into the eyelid. Next comes the layer of the non-striated muscle. It contains the muscle called Mueller muscle, which is involuntary, that is which is not in our control. The main function of the Mueller muscle is it works together with the levator palpebral muscle, which helps in elevation of the eyelid, as well as it also gives the strength and support to the eyelid. And next comes the layer called conjunctiva. This is nothing but the mucous membrane. The conjunctiva, which is covering the inner part of the eyelid, is nothing but the palpebral conjunctiva. This is all about the eyelid anatomy. I hope I made it simple for you. If at all if it is useful for you, please like it so that it will be an encouragement for me, so that I can do few more videos. If someone needs it, please do share it. And if you have any doubts, please feel free to leave a comment. Please do subscribe my channel. Thank you. Thanks for watching.